people want to hear stories of impact. They don't just want to hear the numbers. They're both quite important, but really you can bring to life those stories of impact by telling people exactly what that means to people you're working with. So using that to inform future action and set strategic direction and actually support improvement over time, knowing what's worked for you so far, what has had a real impact, and what that means for you in the future. And that's a continual process. So you'll be learning as you're going and as you're telling those stories and you're sharing data of your impact. Now, the third one is measuring what matters. We have spoken a bit about this already. I've spoken about moving from what we have delivered to what has added value for our local community. That's a key shift in anchor measurement. But what that is also important for is knowing that you're addressing local priorities and you're focusing on activities that are important to your local community. Now, you might start out, or you might actually choose to base your anchor work on national approaches to addressing health inequalities, or use examples like Core 20+5 to kind of look at how you can create that anchor work from the beginning. But over time, your progress is going to be monitored and activities are going to be changed, developed or expanded as you get some information about how you're addressing those needs. So this is really about building that hyper-local approach to measuring what matters and to reporting on that, and to actually checking back in about, are we intentionally delivering and supporting the local community, delivering on what we want to, what we intended to, and supporting the local community. The fourth one is embedding accountability, and this one is quite well linked to the last one. And this is really about those measurements being very transparent and making sure that we can embed this culture of accountability to local communities and other stakeholders. We're going to have a really fantastic example in a moment from Kevin of exactly how that's been done in practice. Now, that's really interesting from the perspective of how you can engage stakeholders directly in talking about the impact you're having and evaluating that impact over time, and actually building that culture throughout the whole of your organization. And the last principle we're going to speak about is taking that collaborative approach. So this is really about focusing on that contribution that you're having as an anchor organization as a whole, helping to move that anchor organization away from a competitive environment to that more collaborative approach. And this might be thinking about the impact you can have with partners across the whole of the anchor system, and actually building up that picture, and also internally within the organization, building up that picture of what we can do together as a whole. And that's particularly important as we move towards working collaboratively to deliver on our anchor initiatives. I'm going to pause for a second because I've given you loads of information. I just want to make sure that we do have some time for you to pop your reflections in the chat, because that's really important to us. So we'd love to hear from you right now, which of those anchor principles, anchor measurement principles resonates with you, and which of those you think is most important in your local setting. And I'm going to come back in just a minute to read some of those out and actually hear from you, because we think that's really important to do. But moving us on, I did promise that I'd take you through a quick view of what this looks like over time in an anchor organization. So this is a quick stab at what this might look like in your organization or some anchor organizations where you're beginning in your anchor journey. As I said before, your organization is making a huge investment, and what's important at the beginning might be to report on delivery, so to make sure that you are actually showing progress against those objectives that you set, those anchor objectives, and those agreed anchor activities. But what might happen over time is actually you realize we've made some really great progress, but we also need to know where to go in the future. And this is where we go back to the principle around looking forward, around planning for what's coming next. So shifting from reporting to informing decisions. Actually, once you've started on your anchor journey and you start to see some of your impact building, that's a fantastic time to think about how you can guide your future work. And then lastly, actually, this one often most importantly for anchor organizations as they shift through time, competing priorities might move people away from considering anchor activities as extremely important. And what we want to do is make sure that we are going back to that and giving people that sense of what we can collectively achieve as an anchor organization. So this is really about building on that momentum, making sure that we're keeping that momentum going. So that's a little bit about how you might change the way you use measurement as an anchor organization over time. So Julie, I wonder if you just give me a really quick time check.
Yeah, absolutely. It's 5 to 1, so we've got a couple of minutes more, and no questions in the chat yet. So if anyone does want to send a reflection or a question, do add in. Now is your chance. So yeah, Jahan, back over to you for a moment.
Fantastic. All right, so one last bit to take you through on anchor measurement, which is that, as I said before, this is an ever-evolving area of work. We're learning what works for anchor organizations, and many anchor organizations are building on this over time. Now, what we've done is actually collated some of those resources for you so that you can see them in one place. And that includes these two fantastic videos on the right-hand side. They're interactive, so when Sav pops that link in the chat, you can actually click straight through from the learning product. They'll take you through to these videos. And these are previous sessions that we've held where there were areas that were very much relevant to anchor measurement. So you'll see the top one is the Northern Care Alliance, Donna actually speaking about how they do anchor measurement and the tools and the approach and the method that they use in her organization. And the bottom one is actually from our colleagues over at the HACT organization. So that's talking about how housing associations do this. And they've been doing this for a very long time. And this webinar was actually about understanding what is the crossover and what can NHS organisations learn from them. So that's hugely interesting. And you'll see that we've got a couple of great examples here of other anchor organisations from across the pond who have been doing this for a while. And we also have some information about examples across the whole of the UK that might be helpful to look into. So let me pause right there, and what we can see that Julia's popped that into the chat for you, so you can have a look at that learning product in your own time. And what we'd like to do now is just take a quick pause to reflect on what this might mean for your anchor organisation and in your local context. So just having a look through the chat at the moment, we'd love you to pop some more reflections and thoughts into the chat on what this means for you. And specifically, I can see some of those coming in, that's great. Specifically, you might want to answer the question, what is the best use of anchor measurement in your organization right now? What is important for you right now from an anchor measurement perspective? Fantastic. So I'll give you another 30 seconds or so to pop your reflections into the chat. I can see that Les has started us off here mentioning that there is recording metrics in his organization, the Leeds Anchor, in his network, the Leeds Anchors Network, which covers quite a range of areas. So that's really interesting to see that you're looking at a huge amount of data and metrics across many varied areas. And that's also in line with progression frameworks. So that's really interesting to see. All right, Julia, can I pass over to you whilst people are popping their thoughts in the chat?
Thank you, Jahan. Really, really wonderful to have you talk us through that. And yeah, there's a huge amount in that resources bank as well, which is well worth looking at. I can see some of the really rich examples of local practice coming through on the chat. So we're going to move on now to introduce Kevin Garrett, who's in Mid and South Essex. And some of you may have heard him talk about their work before. They've done some really interesting stuff, and we really wanted to bring in a case study live for you. So Kevin, I'm going to hand over to you and just let us know when you want us to move through the slides, and then I'll give you a heads up when we've got 2 or 3 minutes left, if that's all right.
Okay, thank you, Julia, very much. Good afternoon, colleagues. It's fairly warm here, somewhere close to Mid and South Essex, but I guess we're all going to be very warm as the next couple of days go on. So let's hope it's not going to be so difficult as perhaps some areas are indicated. But the challenge I've been given is to try to bring some of what you've just heard about to life. So there'll be a few variations through this, but for those that are not familiar with Mid and South Essex, the picture shows a welcome to Basildon University Hospital. That's one of our 3 hospitals. So we've Chelmsford and Southend. In addition to that, we have about 1.2 million people living on that patch. There are some particular kind of regional complications. We have a relatively high number of local authorities in that mix. But to the right-hand side, you'll see something called Putting Communities at the Centre, which is discreetly, or not so discreetly, covering up our formal logo. And really, that's a report that we published in May alongside a formal evaluation of our anchor in its first full year, expanded from Basildon to cover those other 2 sites. And so that's what I'm going to try and major on and bring to life against the strands that Jahan very eloquently identified for us. So it'll be a quick canter through, but if I can have the next slide. I thought actually it will also be really quite helpful to say, first off, it's a foundation trust anchor program, which is perhaps just moving as we develop our ICS into having a more system-wide focus. But we have always had a charter across our emergent ICS as was that committed us to tackling inequalities, reducing health inequalities, opportunities for young people, life chances, and working with more disadvantaged communities. And we took it at both an anchor principle perspective, but also the work that we were doing. So around social value, around net zero, all of those things came into play. I'm also very keen on a model that talks about evidence, action and learning. So, you know, as an anchor program manager, I was quite keen to have a hook to hang something on, and I like sharing that. Excuse me. So this is something from the World Health Organization. It's actually a couple of years old, but in its executive format, executive summary, it's really quite useful just to kind of get people's focused minds on, particularly now currently, the benefit that the NHS, or the objective of the NHS, to deliver health, economic and social improvement. And you know, it could be that we are approaching a significant downturn in the economy. So these are really important things to hold on to in kind of grounding our anchor delivery. So next slide, please. And so this is an outtake from our Putting Communities at the Centre. It's available on our website. I'm sure we can potentially distribute the link for you. And actually, it's also quite a good example of occasionally how easy it is to fall into a trap that actually is not perhaps the best way. Very often, we narrate our journey through Anchor in terms of timeline and progress and the things that have happened, as opposed to thinking about the impact on individuals. So we got away with it this time on the right hand side, and you can see the extent of our patch there. It's significant, and it runs from urban and deprivation to rural and affluent. But actually we focused in there a quick snapshot of some of the activity we've taken on in the last year. So next slide, because we'll really start to get into the detail of bringing some of those elements that Halm have identified into higher resolution. We have a particular project. It's called Ukfcrf Southend 2050 Ambition. It's a very lengthy title. The ambition was to be a city, and in the most uncertain circumstances, we've achieved that. But nevertheless, the project is about ensuring that the NHS as a destination for quality work is available to those people who are unemployed in Southend and who lived in more disadvantaged circumstances, and about strengthening roots between themselves and ourselves by way of the agencies and support that is available to help them to find work. So in that context, I'm thinking, for instance, Restart or Shore Trust programs that are led by DWP. Now, at the bottom, you'll see a big tick box. The project has been stretched through a full year, so that's just a 6-month figure, and we have achieved many of our ambitions. Some of that is on the back of the eat or heat, the rising cost of living conundrum that is potentially driving the employment or the labour market. And there's a great video there. Watch it. It takes 2 minutes. It will tell you all about a kind of multi-agency approach that we're leading as hospitals in that mix. But actually, the really important part here is that we had some changes that we aspired to make to people's lives. The project is just about to begin its evaluation phase, and we had a VIP visit last week from someone from NHS England, which really did give participants the opportunity to be able to tell their story. and what's changed for them and the impact on themselves. And it's always important, I think, that we get the quantitative and the qualitative in place, and we are able to narrate those stories of what's changed and what has hopefully improved the result of our actions. You know, it's not just that we have this number of job seekers, it's the change that it's made to their lives. Next slide, please. And I'm probably teaching many of you to suck eggs in a way, but this part takes us on to how do we extrapolate that? How do we do the informing? How do we get the anchor vision across? And in this particular slide, we've chosen to use a social value or a themes, outcomes and measurements extrapolation. And that gives you some indication of the sort of proxy figures that are alongside supporting somebody into work, because it's about those communities being wealthier, but wealthier communities in general tend to be healthier, and they use less of public services, less doctors' appointments, less benefit advice. So all of that is calculated up, as I'm sure many of you will be aware, to give a proxy value, and then it's prioritized on a 1 to 3 scale. So that's the model we've used. It's fairly publicly and widely available across Essex, and there are many other similar models as an example. And we do that at 2 layers. It's increasingly recognized that the hospitals in themselves have a value because we spend money locally. We've got our 45 million figure there, but also we do things like we develop our people. So that 2 million figure at the bottom is about the apprenticeships that are non-clinically based, that help people to develop their careers and their spending power, potentially in Essex and beyond. So it's that journey around economic well-being that's really important. And there are other indicators here.
Just 3 minutes left, if that's all right.
Really, I have got to canter. Sorry, Julia. I'll move fairly quickly on to the next slide then. This run is really just about bringing us back to line with this sense of hyperlocal, and I'm going to save a bit of time and concentrate on the UK Southend Ambition 2050 project, because this can happen at a number of different levels, but that particular focus was there on 6 disadvantaged areas of Southend and working with community anchors. So you could also argue that we were meeting that local criteria there. Most of our work tends to take place locally, but increasingly the ambition is to upscale that. So our learning disability internship, for instance, is now scaled up from Basildon to our other 2 sites. Next slide, please. Oops, there's that. And another one. Okay, so this is just a very brief show and tell around accountability. And actually for us, it's much more than just having a board. We meet monthly, but it's not board, it's more informal than that. It's called an institutions meeting. But actually that we're accountable to our partners and our stakeholders. But more than that, it's also about non-execs, it's also about governors, it's also about locally elected councillors, and increasingly alliances and the pieces that put the ICS jigsaw together. It's about being responsive and open and being able to actually advise people, as I did yesterday, that actually, do you know what, the spend is even. It's not perfect, but it's reasonably well distributed. So I've got a final couple of slides. And so this one is just rehearsing again this importance of having some basic data. So we know what our spend is, we know how many people we employ, and we know that impact on their lived experience. As an example, about 50% of our Basildon workforce actually lives in the 40% most disadvantaged areas of Basildon. So that's quite a telling statistic, and it helps us to think around their lived experience by way of informing the lived experience of Basildon. As I said at the outset, we have something about evidence, action and learning. So the next slide, please. So in terms of action, or rather learning, or rather actually developing and collaborating, this is a particular piece of work that we're undertaking for the Health Anchors Learning Network Test and Learn. But actually we've borrowed from what's already available in terms of a youth employment system map. And it's about being able to bring in some presentational resources that help to bring those stories to life, to identify where resource is, but actually what's the impact of that. And that final part to the right hand side, Changes Brewing, for instance, we have a barista in our staff restaurant in Southend, where the organisation's rationale is about developing life skills and employment support and training, and critically a roof over people's heads for those people that are homeless. I think we have a final slide just to take us home. Hopefully I've picked up a bit of time. I'm sorry for the additional canter through, but in terms of just using this slide to extrapolate some of what I've been talking about, a lot of our Mid-South Essex activity will talk to, and I've bolded in particular the highlights around our youth action work and trying to support a really solid pathway for young people 16 to 24 that have perhaps not had the best of life chances to date. And if you like, to the left-hand side, that may be some of what they've experienced already or not. But actually what we're looking towards the right-hand side is the benefit in many cases that work within the NHS can deliver for those individuals who are perhaps, for instance, young adult carers or care leavers who need that additional intentional support to help them on their journey as much as it is for work for us. It's about activating our communities. So I'm going to bring that to a close.